Our next guest was only 11 years old when she started experiencing seizures, and it only got worse as Chastity Roberts got older. At one point, she was having nearly 30 seizures every single day until she met Dr. Nitin Tandon. So what finally helped her become seizure-free? Chastity and Dr. Tandon join us now with the answer. Welcome to you both. Thanks so much for your time. Chastity, I want to start with you. Pretty scary at 11 years old. Tell us what you remember about that time and as things seemed to get worse over time.
Hi, I just remember being terrified, not knowing what was going on, going doctor to doctor, taking medicine after medicine, and not being able to find an answer.
And during that time, you had also tried a number of things, right? Medication, that didn't seem to help. So surgery is eventually the option you chose?
Yes, that was our last resort, surgery.
And tell us about how you're doing today. I know, I understand you came from Lufkin and you moved
Yes.
down here close to the city up in Humble, and now you work as a nurse?
I do. I've completed nursing school and I'm still going to nursing school to continue my education, and I live an amazing life, one that I never thought that I'd be able to live.
No
I
more
have
seizures?
so many opportunities and it's wonderful.
And no more seizures at this point?
No more seizures.
That is incredible. Dr. Tandon, I want to bring you in. Let's talk about epilepsy. So this is a neurological condition faced by more people than we even realize. Talk to us about some of the treatment options that are available and essentially what is epilepsy? We're seeing some of that on our screen right now.
Yeah, it's exactly as you say on your screen. It's a neurological condition characterized by recurrent and unprovoked seizures. And it can be caused by a variety of different conditions in people's brains, including tumors of the brain, abnormalities of brain formation, areas of the brain that have scar or damage from a variety of different things in the past. And this is just as important. It's the second commonest neurological disorder after stroke. And so it's an extremely prevalent disorder. And cases like Chastity are actually not that uncommon. What is uncommon is the numbers that actually get seen by specialized centers for evaluation and surgical treatment.
Well, and epilepsy, I'm sure a lot of our viewers either know someone with epilepsy or have dealt with it themselves. 3 million Americans this condition affects. And you, Dr. Tandon, you've performed more than 3,000 cranial operations. So talk to us about the situation, like Chastity's situation. It's incredible that she went from 30 seizures every single day to now having none. What is the process? What's the surgical process that allows someone to achieve those results?
So the first caveat to this is that the type of seizure, the type of epilepsy that an individual needs to have should be focal, that's in starting from one spot in the brain. Sometimes the MRI scan, which we use, shows us exactly where that spot is. But in Chastity's case, her MRI was actually normal. So we implanted probes in her brain to evaluate where the seizures were starting. She had some very interesting seizures that were accompanied by changes in vision where there were things that she was seeing that weren't actually there, hallucinations, if you will, almost visual hallucinations that she can tell us more about. And we used that information to guide the placement of these probes in the brain. With these probes, we were able to pinpoint a location that was responsible for the seizures. And then we took the probes out. She went home, recovered from that procedure, and we brought her back and removed a very small portion of the brain, about half the size of a golf ball, that was responsible for her seizures, very close to her visual regions, and therefore producing those kinds of seizures. And that journey is pretty typical in most patients with an intractable, which is a type of epilepsy that does not respond to medications. Either patients have a direct resection or they undergo an evaluation with implanted electrodes to pinpoint seizure foci and then a resection thereafter.
It really is incredible. And what's even more incredible in my mind is that many of these patients are actually awake, so you can talk to them during this process. We're out of time, but Chastity, final thoughts from you. What's your message to someone out there who is living with epilepsy?
that there are so many options for you. Please don't give up. Keep looking. If surgery is for you, it can help. It gave me a complete lease on life, a new lease on life. Just don't give up. Dr. Tandon's team really helped me, and I appreciate them.
Well, Chastity Roberts, Dr. Nitin Tandon, thank you so much for your time. Chastity, we're so glad to see you doing so well. Thanks again for your time.
Thank you.
And to
Thank
our
you so
viewers,
much.
if you would like more information, you can go online, memorialhermann.org/epilepsy, or you can call 713-222-2273.